Dr. Michael Ryan with Missouri Vein Care answering a question. Um, should I have a vein treatment now or should I wait? And so vein conditions are very common. One in three adults has a vein condition. So we see people that come in with concerns about their vein circulation and they want to know, should I have a treatment now? Is this important? Is this dangerous? And I would say to the question, is it a dangerous condition? I would say it is not a dangerous condition. I tell patients that people don't die from the kind of vein condition that we're talking about, which is vein reflux. They don't typically get blood clots. That's not part of this problem. People get blood clots from other conditions, but not from vein reflux. People don't lose their leg, and they don't have keel over and die kind of problems. So I tell people that's a reassurance to many people. The question about blood clots, people get blood clots for other reasons, primarily inactivity, being overweight. Uh, there may be an underlying genetic predisposition to blood clots. There may be recent surgery or travel. Those are reasons people get blood clots. It's usually not related to a vein condition. So the next consideration, I had, you have a vein condition, and maybe some leg symptoms, some aching, maybe some trouble falling asleep at night, or maybe some cramps a couple times a month. And so the question is it should you get a vein treatment now? And all of those symptoms are very commonly related to a vein condition and improve or go away completely after treatment. And what I tell people is that generally it's up to them and their sense of how they want to manage their health. One of the things they need to understand that they may not be aware of is a vein condition does not go away on its own. Compression stocking use does not make a vein condition go away or get better. And it will continue to slowly worsen and march out every year, which means you'll have more symptoms every year. You'll have new symptoms develop. Uh, the veins that are visible become more prominent, and you'll get new veins becoming visible. That's how a vein condition works. And that is the march of time of a vein condition. So for some people, it makes a lot more sense to do it earlier rather than later. Everyone's situation is different, and I can certainly talk to people and help them with their decision making. But I tell people that they have to decide in managing their own health, when do they think it's important to take care of that problem, because that problem will never go away. They're going to have to take care of it at some point. And uh, for many people, sooner rather than later, or maybe later in the year, or maybe the next year might be a better choice for them. And we can have a conversation about that. The other thing is, I tell people that if they're happy with their level of activity, let's say they're not really you know worried right now, they're able to do exercise and chores and activities and work and sleep at night. They have some symptoms, but that isn't really bothering them. I tell them that it really makes sense, if they're not concerned about being proactive about their health, to keep an eye on it and respond in the future if they have symptoms that are worsening. And the symptoms typically do worsen, and usually people have plenty of time to get it taken care of. So everyone's situation is different, and everyone's focus on their health and their lifestyle is different. And that's a conversation that I have with patients, and I try to help them make a choice that's right for them. And I know that for most people that don't have a treatment today, they'll probably have a treatment, tomorrow or next week or next month, because that's the nature of a vein condition. And we just have to find the right time for that patient. So Michael Ryan answering the question, should I have a treatment today or tomorrow?